Local doctors are now sharing insight on two new COVID variants, one of which is already on its way to be the dominant variant here in the United States. Here's where we stand at the moment with weekly case growth across the state of Kentucky. As you can see, case counts since the start of the year are starting to drop as you go from the left of your screen over to the right, where we stand at the week of the end of March 21st. But we're going to keep our eyes on these numbers as we move ahead. And WHS 11's Ford Sanders has been talking to medical experts today, breaking down what you can expect from the new variants here in Louisville.
BA.2, it's now on its way to dominate U.S. COVID infections. As the CDC reports just last week, it made up about 35% of cases. But where did it come from and how can you avoid it?
I think many people are concerned, as am I, that there will be a spike. What that spike looked like may be somewhat different.
Those words coming from Dr. Joseph M. Flynn with Norton Medical Group as he provides more insight on two new COVID variants, one of which is already making its rounds across the U.S.
It's more infectious. So what we've seen is that people are more apt to get to see the transmission of the virus.
Dr. Anthony Fauci also saying it doesn't seem to pose any more of a threat than the original Omicron.
It's a very interesting situation where the cases are going up, but it does not at this point in time appear to be any degree of severity.
The CDC already reports that BA.2 is making up 35% of all infections. But what does that mean for Louisville?
My guess is we'll start seeing a mirror image of what we've seen in other parts of the country.
Dr. Flynn says there is a silver lining, however.
For BA.2, it looks if you've received the full armamentarium of vaccination and boosters that you are protected. There's a lot of data showing that if you had the BA.1 variant, that you're protected for the BA.2.
That brings us to the other variant, Deltacron. The new strain of COVID-19 is described as a combination of both Delta and Omicron variants.
I don't know that this is going to necessarily become selected out to be something we're going to have to deal with. There was a lot of talk early on, and even within the last weeks, that was this just a lab error.
Dr. Flynn mentions there are a group of drugs, however, that provide protection for new strains popping up.
For those that get infected, taking those medicines can decrease your risk of severe disease, specifically hospitalization and death.
When asked about what he thinks of a possible takeover of BA.2 here in Louisville, he says, well, it's actually possible we could see what Europe is seeing, where it is now the dominant strain. In Louisville, Ford Sanders, WHS 11 on your side.